Unfortunately, the genetic balance sheet and the health balance sheet of Indians is not that healthy. Young and middle-aged Indians are becoming vulnerable to various non-communicable diseases. Today, 60% of deaths in India is due to non-communicable diseases, and number one killer is heart attack and its cardiovascular related disease. And most important, this particular heart attack is occurring among younger people. In fact, earlier, children used to bring parents for the treatment of heart attack and its various cardiovascular disease. Today, parents are bringing their children in the age group of 25 to 45 for the treatment of heart attack as well as brain stroke. So this is where, to address this very important issue, our Honorable Prime Minister Narendra Modi ji has brought in one of the biggest public health scheme in the name of Ayushman Bharat. So today, otherwise for all these problems, our poor people were selling jewelry and they were selling lands. In fact, the treatment is so expensive in private corporate hospital, and what they spend in corporate hospital is their lifetime earning. To address this issue, the Ayushman Bharat is in place ever since 2018, September 23rd, and till now we have treated under the scheme more than 6 lakh crore beneficiaries have been treated, and 65% of the population, at least 65 crores have been benefited. They are the Ayushman Bharat beneficiary. Why I am stressing this heart attack issue? Because heart attack today is no more a disease of elite class, is no more a disease of rich people. It is equally increasing among poor people, farmers, villagers, laborers, and even underprivileged. And the treatment of heart attack is time driven. For every 30 minutes of delay in initiating treatment for heart attack, risk of death increases by 7%. So this is where time has come. We have to adopt what is called hub and spoke model for treating heart attack. The spoke hospitals has to be taluk hospitals, and hub hospital has to be the tertiary care hospital in nearby bigger cities. So initial treatment has to be given in taluk hospital under spoke and hub model. We have what is called 1 minute injection of clot dissolving drug. If that medicine, a simple injection in an ordinary MBBS doctor can do with little bit of awareness, if it is given within the first 3 to 6 hours of heart attack, risk of death comes down by 20% to 5%. And otherwise, what is happening today in semi-urban and rural areas, heart attack patients and stroke, they are traveling hundreds of kilometers to bigger cities, thereby precious time is lost. So, as a result, today Ayushman Bharat covers all these expenses. So I was part of this hub and spoke model of heart attack treatment in our state of Karnataka. We have implemented in 45 taluks. Now it is being expanded to 90 taluks. It is in place in some other states also, like Tamil Nadu, Goa, Maharashtra, Orissa. So India should adopt this spoke and hub model of treating heart attack patients across the country, so that the patient with heart attack should get heart attack treatment at the doorstep in taluk hospital within that golden hour. If that treatment is given after 12 hours, now the model how it works, initial treatment is given at this peripheral rural hospital, the injection is given, which cost about 18,000 rupees. It is covered under the scheme, and with usage, as usage goes up, it would be available even for a lesser cost. Then after 3 to 6 hours of giving this injection, they are shifted to nearby bigger places where angioplasty and stent procedures are available. So this, because the economic impact of this life loss due to heart attack and brain stroke, the Harvard School of Public Health Policy and also World Economic Forum has estimated over a period of next 13 years, if the same trend continues, probably the economic loss for the country will be almost around $2.17 trillion. To that extent, it can happen. And hub-and-spoke model is another thing. The stent that was used for fixing the blockage of the arteries of the heart, which was costing 70 to 80,000 rupees earlier, due to the intervention by Honorable Prime Minister and the Health Minister, now the cost of the stent has been reduced from 80,000 to 25,000, which is a great boon to the poor patients of India across all states. Another important thing is we are talking about this Janaushadhi Kendra, which as my honorable other members have already talked, because there are 10 crore diabetics in India. Another 10 crores are on the verge of becoming diabetic, and it's a lifelong medication. As a result, Honorable Prime Minister has opened nearly 12,000 Janaushadhi Kendra, which is going to be of a great help. So there was a criticism about Ayushman Bharat. The package rates are not that very remunerative. As a result, private hospitals are not getting empaneled. But the latest package revision that occurred in 2022 has given a very decent package rate. Now probably, another important thing, the health subject, medical education subject is also a state subject. So now what is happening, the time has come, we have to strengthen the existing hospitals. We have to strengthen the existing medical colleges with manpower, technicians, and staff nurses. That is where we are lacking. So theme should be we are only talking about construction of hospital, construction of medical colleges, construction of AIMS. The theme should move from construction to creation of post. From creation of post, it should move on to recruitment. So that will put up, because India has got a great talent pool. Today we have close to 14 lakh allopathic doctors and 5 lakh we have Ayush doctors. Our target is just another 3 lakh doctors are required. In the last 10 years, there is an exponential increase in the number of medical colleges. My hearty congratulations to our Honorable Prime Minister and the Honorable Health Ministry, because today there are 386 government colleges and 326. But most importantly, yes, we are going to reach this number, strategic number, in about 2 years. But most important, I have a strong feeling. My suggestion would be, yes, we should have more medical colleges, but number of seats should not exceed 150. Number of seats should not exceed 150, because in many medical colleges today, there are more medical students than the patients. As a result, they are not getting hands-on experience. Undercooked and under-trained doctors are more harmful than the disease. That is one thing. Another important thing, the medical college recruitment is purely a state subject. So that is where the state has to put a lot of their interest in, because Government of India is giving grants toward the construction, and recruitment is purely a state responsibility in medical colleges apart from our